Welcome graduate nurses. In the following video, we will be discussing a range of psychotropic medications used in the treatment of mental illnesses, including antipsychotics, antidepressants, and anxiolytics. It is important to have a basic understanding of these mental illnesses. Anxiety is a common human experience that is a normal emotion felt in varying degrees by everyone, also a state in which an individual experiences feelings of uneasiness, apprehension, and activation of the autonomic nervous system in response to a vague, non-specific threat. Depression is a disorder characterized by depressed mood with feelings of hopelessness and helplessness, lack of pleasure or interest, appetite disturbances, and sleep disturbances and fatigue. Psychosis is a condition in which a person has impaired cognition, emotional, social, and communicative responses and interpretation of reality. The following discussion will include how the drug works, what types of conditions, illnesses that medication is used for, routes of administration and dosage range, and the major side effects associated with the medication group. Up first, we have Dominica.
Hi, my name is Dominica, and I'll be briefly talking to you about antipsychotics. Antipsychotics are a class of psychiatric medication primarily used to manage psychosis, which include delusions, hallucinations, or paranoia, and is used principally to treat schizophrenia and to reduce the symptoms associated with psychotic conditions such as bipolar, psychotic depression, and drug-induced psychosis. Antipsychotics fall into two types of categories: typical and atypical antipsychotics. Typical antipsychotics were discovered in the 1950s and are not particularly selective and also block dopamine receptors in the mesocortical pathway, tuber-infundibule pathway, and the nigrostridial pathway. Blocking D2 receptors in these other pathways is thought to produce some unwanted side effects that the typical antipsychotics can produce. Atypical antipsychotics have been developed more recently, with the first atypical antipsychotic, clozapine, being introduced clinically in the 1970s. Atypical antipsychotic drugs have a similar blocking effect on D2 receptors. However, most also act on serotonin receptors, especially the 5-HT2A and 5-HT2C receptors. Dosage and route of administration must be individualized according to the person's condition and response. Oral liquid concentrates, orally dissolving formulations, and intramuscular formulations are preferred over oral tablets because of the faster speed of onset. Oral drugs undergo extensive first-pass metabolism in the liver, so that a significant portion of a dose does not reach the systemic circulation and low serum drug levels are produced. In contrast, intramuscular doses avoid first-pass metabolism and produce serum drug levels approximately double of oral doses. Thus, usual intramuscular doses are approximately half the oral doses. When treatment is initiated with oral drugs, divided daily doses are recommended, with an initial dose of 12.5 milligrams orally 1 to 2 times daily, then slowly increasing the dose over 2 to 3 weeks until 200 to 450 milligrams per day in divided doses is reached. People who take antipsychotic medication may experience negative symptoms, which include headaches, dizziness, weight gain, and sedation. Extrapyramidal effects may also occur, which involve dystonias, akathisia, and tardive dyskinesia. Thank you for listening, and now we're moving on to Olivia.
Hi, I'm Olivia, and today I'm providing you with education on the topic of antidepressants. Antidepressants are a specific type of psychotropic medication. They may be prescribed when symptoms are resistant to psychological treatment, are severe, or the individual may have no access to treatment. They are used to treat a range of conditions including, but not limited to, depression, anxiety, obsessive-compulsive disorder, and bipolar disorder. For example, symptoms of depression may include prolonged feelings of sadness, a low mood, lack of motivation, and disinterest in regular daily activities. Therefore, antidepressants would be a suitable method of treatment. Antidepressants improve mental health by correcting chemical imbalances of neurotransmitters in the brain. Therefore, beneficial for individuals experiencing mental health issues, as chemical imbalances in the brain are responsible for changes in mood and behavior. The key neurotransmitters involved in depression are dopamine, norepinephrine, and serotonin. Overall, antidepressants work by inhibiting the reuptake of specific neurotransmitters, where the 4 different classes of antidepressants differ in the neurotransmitters they affect. These 4 different classes of antidepressants are as follows: SSRIs, selective serotonin reuptake inhibitors, atypical antidepressants, typical antidepressants, and monoamine oxidase inhibitors. Side effects associated with antidepressants depend on the type of class you are using. SSRIs are said to have fewer side effects and are the most commonly prescribed class of antidepressants. They work by blocking the reuptake of serotonin back into the brain cells, and so the amount of serotonin available in the brain for transmitting signals is increased, which is thought to improve symptoms of depression. Side effects common amongst all classes of antidepressants are nausea, dizziness, weight gain or loss, decreased sexual drive, fatigue, dry mouth, and insomnia. Withdrawal in symptoms can include dizziness, paresthesia, anxiety, sleep disturbance, agitation, and tremors. In regards to dosage, the doctor is responsible for the prescribed range and frequency. This can be dependent on the severity of the condition. They are usually available in oral form, such as tablets. However, in cases where this may not be applicable, there are alternative routes of administration. This can include intravenous therapy, intramuscular injections, long-acting depot injections, or possibly even powder forms for inhalation. It is important to recognise that it can take up to 6 weeks after the first dose to take effect, and the maximum benefit is felt after 6 months. Thank you for listening, and I'm now
Hi, my name is Tiff, and today I'll be talking to you about anxiolytics, also known as anti-anxiety medication. Anxiolytic medication is used to treat symptoms of acute anxiety disorders. They can also be used to treat short-term fear or phobia, such as public speaking, and they can also be prescribed for insomnia, seizure disorders, skeletal muscle relaxation, alcohol withdrawal, and psychotic agitation. Benzodiazepines are the most common class of anti-anxiety medication. They include Xanax, clonopine, Valium, and Ativan. Diazepam is the most common anxiety medication. It is widely used and very safe when used correctly. Anxiolytics such as benzodiazepines work by reducing brain activity by targeting neurotransmitters and decreasing abnormal excitability. Benzodiazepines act by enhancing the actions of a natural brain chemical called GABA, gamma-aminobutyric acid. GABA is a neurotransmitter that transmits messages from one brain cell, neuron, to another. GABA tells the neuron to slow down or stop firing, resulting in a calming effect. Anxiolytic medications are often combined with psychotherapy or cognitive behavioral therapy, in which together they can help improve quality of life for people with anxiety disorders. Dosage may vary due to different circumstances and should be individualized to minimize sedation. Anxiolytics may take up to 2 to 3 weeks before a patient will start to see any results. Anxiolytics are commonly given in tablet form, which could be dissolvable or liquid, or injection. Benzodiazepines should be administered 30 to 60 minutes before exposure to anticipated stress. Some of the side effects that come with anxiolytic medications are drowsiness, reduced mental acuity, impaired motor performance, headache, feeling of detachment, nausea, hypertension, and restlessness. Anti-anxiety medications aren't known to be highly addictive if they're used correctly. Side effects and risks of anti-anxiety medication are mainly dose-related and usually short-term and harmless. A consumer should be educated on the medications and the side effects as they could experience. They should also be warned about the risks of driving a car or operating dangerous machinery while taking anxiolytics. Now on to Kayla to finalise this presentation.
Now
Thank you
we'll
for
speak
watching.
briefly about the nurse's role in medication administration. As healthcare professionals, it is our job to inform and educate the patient on their illness and medications they require in a clear and easy to understand manner. It is important that the patient understands what medication they are taking and any side effects they may experience as a result, as well as the time frame of which the medication may take to have an effect. Nurses must be aware of the 5 rights of medication management when administering psychotropic drugs and should monitor effects closely in case of a possible adverse reaction where appropriate interventions would then be required. In regards to relapse prevention, good support systems such as family, friends, and healthcare professionals, as well as support groups and identifying triggers are very important in managing prevention. Also, exploring the patient's underlying thoughts and feelings that resulted in the relapse in the first place is also very important. In conclusion, there are a range of psychotropic medications available for the treatment of varying mental illnesses. As previously mentioned, these specifically include antipsychotics, antidepressants, and anxiolytics. Ultimately, the aim of psychotropic medication is to improve an individual's mental state, therefore enhancing the quality of life. Thank you for viewing this presentation, and a special thank you to our educators today, Olivia, Dominica, and Tiff.